Hello, and thank you for joining us. I'm Sandy Potter here again with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and Sierra Drevline, Director of Employee Health Services for Masonicare. Welcome back to you all.
Thanks for having us.
Good to be here with you again. And Dr. Schwartz, well, it's hard to believe we're almost 2 years into this pandemic, and a question that has come up a lot, especially lately, is whether we can become infected with COVID-19 more than once, even after being vaccinated and perhaps boosted as well. What have you learned about this?
Well, again, that's a really good topic, and we have a very nice article that, again, I condensed because there's a lot of information here just to try to give you the main points. So you know what I do? I kind of read this to you. I have maybe a few quotes in here as well, and hopefully you can be, brought up to date on this topic. So the title of the article is actually, "Can you become infected by Omicron twice? COVID-19 experts examine the possibility." So now I'll kind of read you the key points, and they say, and as Omicron continues to be the dominant force of COVID-19 spread across the globe, more evidence suggests that getting impacted twice by COVID-19 is likelier than many originally believed. The rise of multiple variants is translated to a higher risk of a breakthrough case, even for those who are up to date on their COVID-19 vaccinations, as the virus's structure changes over time. Then they go on to say, but as Omicron specifically is proving to be more infectious in nature compared to earlier strains like Delta and Alpha, you may be wondering if it's possible to be impacted by Omicron more than once, especially if you live in an area where transmission is high. So the answer is it's not out of the question. Experts have been saying that Omicron reinfection is a possibility, especially for those with weakened immune systems. And they further say the real concern here, according to experts, is how likely reinfection is when it comes to the Omicron variant. And the reality is that a double Omicron-based infection appears to be quite rare. It's compounded by the fact that current COVID-19 testing doesn't always allow you to understand which COVID-19 variant you've been impacted by after testing is positive, making it tougher for anyone to confirm if they've even been impacted by Omicron in the first place, though that's likely due to the current spread of Omicron. So the next point they say is, can you get reinfected with COVID-19? And they say getting COVID-19 twice is far from impossible, even if you're fully up to date on a COVID-19 vaccination. And scientists have already confirmed that Omicron has earned special attention at this stage of the pandemic, as evidence suggests that the strain spread more effectively than others, demonstrating an ability to reinfect someone who has previously experienced a COVID-19 illness, even sometimes within the CDC's official 90-day reinfection window. And officials at the World Health Organization have equally stressed that potential risk for COVID-19 reinfection is higher with Omicron than it is to other variants they've seen in years previous. A case of reinfection was once considered very rare, according to public health data available in the United Kingdom. So whether your immune system contains COVID-19 antibodies after fighting through infection or through natural response to a COVID-19 vaccine booster, it is possible to get reinfected after either of these events. Reinfection rates are indeed higher now than earlier in the pandemic, but this is somewhat more encouraging. Reinfection caused by Omicron, specifically for those who became sick by its initial spread, isn't as concerning or rampant as confirmed second cases of COVID-19 for individuals who were previously impacted in early 2021 and 2022, fueled by new Omicron spread. So finally, they say, can you get an Omicron COVID-19 infection for a second time? And they say there is a possibility of becoming impacted by Omicron when it comes to reinfection, but there isn't enough data yet to determine how likely this would be in reality, and certain trends elsewhere in the pandemic suggest that any likelihood of an Omicron reinfection for any given person may further be on the decline. So now we're almost done. We'll talk about the bottom line, which is if you're worried about getting sick again, whether from the Omicron COVID-19 variant or from a future variant altogether, the best course of action is to get vaccinated, even if you've recently fought your way through a COVID-19 sickness and have yet to be vaccinated or received the booster shot. Even if you face COVID-19 reinfection, you should expect the sickness may be less impactful a second time around, especially if you were vaccinated. So finally, they say even a breakthrough infection even after a breakthrough infection, the disease severity was so significantly lower, individuals were not necessarily requiring hospitalization, and usually within 5 days or so, they started to feel better. The symptoms were also dissipating a lot faster. So although that's a lot of information and may initially seem worrisome, it's actually not as bad as it actually sounds. And we do know, and we'll speak to this more later in the presentation, that there is a significant reduction in cases and that the positivity rate has significantly dropped. So with all that in mind, I'm going to now give you my quote for the week, which is, "We make a living by what we get, but we make a life by what we give." And that actually was said by Winston Churchill. And I think it was very fitting because really everyone at Masonicare that we work with, gives a lot for our residents to do whatever we can do to try to keep them safe, and again, we continue with good health practices, we, do what we need to do with masking and so forth, and getting, main thing is getting vaccinated. And, again, every week or every other week now when we do these shows, I just wish everyone health and peace. And I wish that again for all of you. Thank you.
Thank you so much, Dr. Schwartz, as always. Sierra, our COVID vaccination policy includes having all of our employee team members receive the booster shot, and we recently passed the deadline for that. Can you tell us how the process went?
Absolutely. So we have finished all of our scheduled clinics through our pharmacy partners at this time in hopes to get everybody boosted within that time frame. Because of the Omicron infections, we weren't seeing the compliance we had in previous deadlines, but we are over 95% at this point. So things are going very well. We will never get 100%, and we see this with the flu deadline. We see this with the original primary series for the COVID deadline too. You're going to have people that are actively ill during the time and they can't receive it. You're going to have people that have exemptions, temporary or permanent medical, and permanent religious, more strongly held belief exemptions in place as well. So we are right on track for our deadline. So yeah, things are going very well. Thank you.
That's great news. Thank you so much, Sierra, for spearheading that effort. And finally, JP, we do continue to see the positivity rates dropping here in Connecticut, which is great news. How is Masonicare responding to this trend?
Sandy, it is great to see the positivity rate dropping so dramatically over the past 30 days, and we're continuing to see that drop, which ultimately will help us get to some normalcy. And here at Masonicare, we actually have been loosening up some of our restrictions, such as the dining rooms have been all open throughout all of our campuses. And that's allowed our residents really to interact. I received an email from a resident later on last week, just thanking Masonicare for keeping all of the residents safe, but also thanking us for opening the dining room for that social interaction. So we are slowly opening up some of our restrictions, but like anything else, this disease or this virus can come back with vengeance. So we are monitoring it each and every day, and our staff have done a truly amazing job. I want to thank Sierra for all her hard work to get us to where we are for the boosters. And Dr. Schwartz, all of your information over the many videos we've had have been truly informative. But our staff have done an amazing job. We're still fighting COVID. There are some minor outbreaks in some areas that we have had to contend with, but our staff, as I said earlier, have done a great job. As we move forward, will there be more restrictions that come up? Yes, we are hearing that both federal and state health agencies are looking at potentially changing the mask requirements. I want to let everybody know that does not necessarily mean that if those restrictions happen, it would have an impact on our communities, because some of those areas still will require those restrictions. Mask wearing in our nursing home, mask wearing in our assisted living communities. We're not expecting that the state or the federal government will be loosening those requirements. They may be loosening those requirements in other areas, but we're not anticipating it happening in our skilled nursing facilities or our assisted living. So that will not necessarily be moving forward. So with that being said, we will continue to communicate when we're making changes to our resident staff and family members. But, you know, at the end of all of this, our main priority is the safety of those that we serve. So we will continue to push and battle this virus in any way, shape, or form that we can and think we should. And the results have spoken for themselves. The staff have done a truly amazing job at fighting this. So it is looking very positive as we move forward.
Yes, that's wonderful news. Thank you so much, JP. And we will remain, as you like to say, Masonicare strong. Well, thank you all so much for sharing your time and insights with us today, as always. And we thank you for joining us once again from home. Until we see you next time, we hope you'll stay safe and stay well.